Yeah, so what is ketamine and why are we using it in a mental health context to help people? There's a lot of myths and misconceptions about what ketamine is in the first place. Ketamine was first synthesized in 1962 in an ideal anesthetic trial, meaning it was a great medicine for putting somebody to sleep without affecting the way that their heart and their lungs are working while they're asleep, so that surgery can be performed on that person. That's very high doses are used as an FDA-approved anesthetic. Now, in an off-label psychiatric context, we will use ketamine at much, much lower doses to induce a dreamlike state, wherein someone connects with their own soul in a way that allows them to heal. Now, the psychology of that experience is very unique to each individual, and being able to predict exactly what sorts of experiences someone's going to have isn't really something that's possible. But once you've had several experiences, you'll get a feel for what to expect. And even then, sometimes you'll find some surprises along the way, which is part of why you'll be walking step by step through it with a clinician like me or one of our therapists here. Now, ketamine does a lot of things biologically that are healthy for the brain, including affecting certain neurotransmissive pathways that there aren't many medicines that are touching. You're familiar probably with antidepressant medicines that affect things like serotonin, norepinephrine, and dopamine, but ketamine works primarily on a pathway called glutamate. And glutamate is like the gas pedal in your brain, and GABA is like the brake pedal in your brain. And one of the things that a subanesthetic dose of ketamine does is correct what's called the GABA to glutamate ratio. It just allows the brake pedal and the gas pedal to be in a proper balance, where oftentimes somebody who's all gas, no brake develops a great deal of anxiety and depression and trauma-like symptoms. So for a period of time afterwards, things are in a balance that they weren't capable of being in before, that's difficult to arrive at other ways. Ketamine is also very anti-inflammatory. So if any level of chronic inflammation is a part of what one of our patients is enduring, if that's part of their difficulty, then that inflammatory component will be crushed out by ketamine. There are studies that have also demonstrated that it's possible to grow new neurons in the brain as a result of receiving ketamine. Chronic stress associated with mental health struggles often results in lower density in the brain, losing a certain amount of brain cells, and we're able to grow some of those back very rapidly in a way that isn't common for medicines to do. It's something that oral antidepressants can do in 6 to 12 months that ketamine can do in just a few hours. If you're looking for mental health care in the Louisville, Kentucky area, go to advancedpracticeproviders.com and you can sign up there for an initial consultation with me or one of our other therapists, or you can call 502-771-1113 to get on my schedule today.